The Alleghany Journal is delighted to host Jeff Lingerfelt, who's the CEO of Bath Community Hospital today. And we asked Jeff to join us because recently Bath Community Hospital was named among the nation's top 100 critical access hospitals. And quite frankly, the Journal doesn't really know what that means. We saw the story. So we thought we'd talk to the top dog himself, and we were very delighted to capture a little bit of his time. Welcome, Jeff.
Great. Thank you, Jerry. I'm delighted to be here.
Well, it's nice to meet you. And achieving this designation, Jeff, it's maybe a little bit short of amazing, but I mean, it's a wonderful achievement. And as you noted, you were quoted, you seem pretty proud of your staff.
Oh, this would have never happened were it not for a very committed staff. And as you know, anytime someone's in the hospital, that's a very trying time, a lot of stress that's involved with that. And it just shows me that we've got caring and compassionate and committed individuals that are taking care of our patients. And I was so happy for our team to get this recognition.
Along the way, when you're a CEO of a hospital in a community the size you have, I noted that recently the hospital has acquired a new state-of-the-art X-ray machine, for example. I mean, that's got to be big bucks, isn't it?
Oh, it is. It was, we started out negotiating for this X-ray machine at about $900,000. But we were able to get it for a little, just not quite at $500,000. So it was huge for us. And it was funny, the guy that installed this machine travels all over the country installing these machines. And he said, I can't believe that a small community hospital this size is getting this kind of machine. He said, this is a state of the art. So we're really happy to be able to offer that here.
I think the Journal's going to have to ask you to negotiate some of our contracts in the future. I don't know. That's pretty.
They feel bad for us, but we're really glad to have it for sure.
Well, help the public with some terminology here. You have a 24/7 wellness center, which is growing in membership. Exactly what does that mean?
Well, we had a wellness center up here. It's been up here for a number of years, but the pandemic made all of us kind of relook and refocus on things. And part of our challenge was we didn't have as many people visiting as we would have liked. So we said, what do we need to do to make this better for the public? And one of my staff members said, why don't we go to a 24/7 model? And so we took the necessary steps to install the cameras that we needed and the electronic equipment that would let people in and out. And we've really seen that wellness center grow significantly because I'm a morning guy. So, and I like to go to bed when the sun goes down. But when I leave here, oftentimes, if it's late in the evening, I'll see a number of cars at the wellness center. So it really is trying to meet the needs of people who have different schedules in the community.
And a drive-through pharmacy. I mean, that's maybe I don't know that much about regional hospitals, but I'm not aware of another one, at least close by, with anything like that.
And our board deserves the credit for that. We had our pharmacy was located in downtown Hot Springs. Parking was hard to get to, and it did not have a drive-through. So they had the vision to say, let's build a new building and let's put a drive-through, turnstile in there. And we've seen a lot of business. I would probably say a third of our business comes through the drive-through.
Wow. Some of us in Alleghany County are very familiar with the Bath Community Physicians Group. How's that going?
It's going really well. Thank you for asking. We've seen a tremendous growth, especially in Alleghany County. We have two sites in Alleghany County on Riverside Drive and Monroe Drive, and it's this past year we went over 20,000 clinic visits, and about 14,000 of those came from Alleghany County. So and this year we're on our clinic volume is about 20% higher than last year. So we certainly are excited to be able to say we're meeting the needs of many of the patients in not only in Bath County, but in Alleghany County, which has been a great partnership.
How do you go about recruiting? And I have a friend that's a hospital administrator in Lexington. I know Lee Higginbotham here in
Right.
Alleghany County, and one of I don't know, I shouldn't call it a scourge. It's a problem. It's an issue that I'm not sure has been completely resolved in many rural hospitals. And by that, I mean, how do you go about getting, for example, as you have, a new general surgeon? Because many young people say, oh, well, I want to go to, I want to live in Atlanta. And many of them are saying, oh, they don't really think that rural life is ideal for them. So you recently, I believe, have acquired, or at least have a relationship with, a new general surgeon. And I'm just kind of interested in, how do you pull that off? How do you find new physicians and recruit new talent?
It was certainly a blessing for us to be able to recruit Dr. Sadovi, who was actually in Rockbridge County, and he wanted to. He has a heart for missions and for rural health, and we started having discussions with him, and then we're able to bring him on about a year ago. And what's been so wonderful about that, Jerry, is our surgery volume. We did 100 more surgeries last year than we had done the year before, more than we've ever done. So, and I expect that number to even grow this year. When you have a physician who cares about his patients, we've had people come from Rockbridge County, Augusta County, to see Dr. Sadovi because he had been their doctor when he was in Lexington, and they just had a relationship with him. I had someone tell me, rarely do you have a doctor that will pray with you. Rarely do you have a doctor who will call you after the surgery and say, hey, I'm just following up to make sure things are going well. That personal touch makes a huge difference. So we're just so blessed to have him on our team.
That is unique. I have to admit. Well, you've been smiling, and that's nice to see that when we have an interview. Sometimes people think, oh, the journal's calling us. It's got to be bad news. But we wanted to congratulate you on being in the top 100 of anything, for that matter, but being a critical access hospital and being so honored. I mean, I'm delighted that you would give the time to the Journal to speak with us about your various operations, and we wish you the best of luck in the future. Thanks very much.
Thank you so much, and thank you for allowing me to tell a little bit of our story.
Yes, sir.